Hi, welcome back to What's Up Doc. I'm Dr. Michael Cohen. I'm a family medicine specialist. Today on the channel, I want to speak about a medication that's called naltrexone, but in the form that's called low-dose naltrexone, and I'll get into details about that soon. I'm going to do this with the aid of a guest on the show, a very special person, and I think it's because I would like to also start introducing patients whom I have had the fortune to look after or have heard their stories. And I think that's because it's a very relatable thing. I think it's something that people can benefit from because we tend to attach memories to meeting people. And so I think that this could be a very useful tool, let's say, for passing on information. So without further ado, I'm going to move on to a video that I recorded just yesterday with a very special gentleman called Raymond. So today we're talking with Ray, who is a very dear old friend and an impromptu patient of myself from about 8 years ago, thereabouts. He has an interesting story which started with him suffering with difficulties in breathing for long periods of time. We'll get into why in a minute. And he was started on a medication that's not commonly used. It's a very old medication, and it's called low-dose naltrexone. The actual name of the drug is naltrexone, and given very low doses, it's termed slightly different as low-dose naltrexone. So I'm going to give you to Ray now. Hi, Ray.
Hi, Michael.
How are you?
I'm doing very well today.
Okay, good to see you.
Yes, reminiscing on the past. I was just briefly mentioned that I was a very heavy smoker, between 50 and 60 cigarettes a day. I stopped in 2001. But approximately 8 years ago, I was in dire straits. I could not walk 10 meters, and I really thought the end was nigh. And then you contacted me, and we discussed this using naltrexone. And it absolutely gave me a new lease on life. I started walking a lot. So I was calculating on my mobile phone, 3,000 steps a day.
Wow.
And yes, it made a difference to my life. And really, I started reviving. And I used it for 2 years. And then my GP over here, I'm in England, by the way, in London. And my GP suggested I stop it. And the point was that I was having 3 different inhalers a day. Salbutamol, the blue one, the brown one, and atropine.
What was the reason, if you want to just share it, what was the reason for the breathing difficulties and the lethargy and everything else that you had? What was the diagnosis?
Well, basically, I contacted the COPD in view of the smoking, and also work as a taxi cab driver in London. The fumes and all that I was breathing in. And the x-rays showed signs of emphysema, but they kept saying it was asthma. The point being that the salbutamol, I was taking as much as 5 times a day, which I'm not supposed to do. But I didn't have a choice. I couldn't breathe.
You were on, I think, 2 or 3 different inhalers, and one of them was a steroid. One of them was salbutamol, otherwise known as Ventolin.
Yes.
And I think you may have been on Atroven, ipratropium bromide as well.
Yes.
And you're also being admitted, if I remember rightly, about 4 times a year into hospital via ambulance.
Yes.
And
I was very prone to getting chest infections.
Okay.
And definitely every time the winter came on, and when the winter went out, I would end up in hospital. During the year as well, I would end up in hospital. And it was getting from bad to worse.
And what about your day-to-day activities? What was that like? Because I think I remember that you like singing very much.
Yeah, but that started after once you gave me that naltrexone, it sort of gave me again breathing and to exercise my lungs. I started singing, and I was able to walk. I said it's a complete new lease on life. It's a different thing completely. I've been clear of hospital, nothing to do with the breathing. I've been once or twice with different things, but nothing to do with the breathing. But I must say that I've had tests, which some of them I sent you the results, the blood tests, etc., the x-rays. And I can't believe it that I'm 86 years old today and my life has changed completely.
Right.
And I could say, honestly, it's thanks to you.
Well, it's not thanks to
Really.
me, but it's hopefully it's thanks to this medication.
Well,
Um,
you prescribed it. You
okay.
prescribed it.
Well,
Yeah. And that made a whole lot of a difference to me. And I think now whatever they're giving me is just sustaining me and leaving me in the good position I was after naltrexone.
right. Okay. Well, that's very good to hear. So I'm gonna get on now and also discuss with the people who are watching this about what naltrexone is, how it was developed, why it was developed, and
Right.
how the idea came about of using it in very low doses and what its potential uses are. So for the moment,
Right.
Raymond, I'm going to say thank you very much for joining me today and for sharing your
Thank
story.
you.
I hope that it's something that will give some information to people that maybe they'll be able to follow up with their own illnesses, because it can be used for a number of different illnesses. And yeah, thanks again. Lovely, lovely to see you.
It's my pleasure. I just hope it'll help anybody else as it has helped me.
I hope you enjoyed the video, and now I'd like to tell you a little bit about low-dose naltrexone, about how I found out about it some 10 years ago, about the kind of patients that I've used it for, and a little bit about how it works and what my impressions are of it. Naltrexone is a drug that's been around for around 50 years, so it's well past its patent and it can't even be marketed in that sense. It was developed originally for helping people to withdraw from heroin or opiate addiction, morphine. And it works because it essentially blocks the receptors in the body which give the person the high of getting a hit, let's say. So if you're not getting the high, then a person has less will and need to use an opiate as a recreational substance. What happened over the years is that back around the 1980s, when the HIV/AIDS epidemic started, a very smart doctor called Dr. Bahari found out that by playing with the doses of this drug, instead of giving 50 milligrams up to 200 milligrams, which was the usual dose, if he gave people half a milligram, 1 milligram, so really tiny fractions of the original amounts used, that he was actually able to alter the way in which the immune system works for the better. So we're not talking about suppressing the immune system specifically, and we're not talking about overactivating it, but let's say directing it in a more healthy, balanced way. And it turned out this was at a time when there was only one drug available for HIV, which was AZT. And he was giving people naltrexone in low doses and finding good results, that people were not progressing on to AIDS. They had the infection, but they weren't developing the diseases. This is quite a remarkable finding. Over the years, it's been used by many different doctors around the world to treat various problems, usually problems which have an autoimmune nature or an inflammatory nature. And I'm talking about problems like multiple sclerosis, which is a pretty severe disease of the nervous system, fibromyalgia that many of you may have heard of, Crohn's disease, certain autoimmune skin conditions, and also chronic pain syndromes. It's also been used for a bunch of other things such as anxiety and depression, post-traumatic stress disorder. And I came about it because of somebody who I knew around 10 years ago, an elderly gentleman who was approaching 90 years old, who felt like he couldn't play tennis anymore because he had some heart problems, some lung problems, and he came across this medication. He was someone very scientifically orientated. He researched it and he managed to obtain some, and he started taking it and he started feeling dramatically better. Now, around that time, I had the good fortune to meet a gentleman called Raymond, who was around 77, 78 years old at the time. And he was suffering, as you've seen in the video, from COPD, which is chronic obstructive pulmonary disease, which means chronic lung disease, which resulted from very heavy smoking for many years and from fume inhalation as a London taxi driver. And he was on all the maximal therapies, and he was at a point, as you've seen in the video, where he could barely walk more than 10 meters. He was feeling really very low, wasn't sure that life was really worth going on for either. And he was reluctant at first, but he agreed to take it. And I said, look, I don't know if this is going to help or not, but from the mechanisms by which it works and by its safety profile, I said, let's give it a go. And so he agreed to try it. And we tried it, and the effects were absolutely dramatic. He went literally within about a month from being able to walk 10 meters to being able to walk about a mile on the flat. He couldn't go up any hills, but that was a huge difference. His production of catarrh, phlegm, went down dramatically. So instead of him sitting there coughing nonstop, he literally wasn't coughing anymore. He wasn't feeling breathless. He was sleeping better. He was feeling better. His mood lifted dramatically. And from another objective standpoint, he was no longer needing to go to hospital. He was, until that point, being admitted into hospital 4 times a year for up to a week at a time to have lung infections treated, pneumonias. So this was really something striking. And since that time, I've used it on other patients also with COPD, people with skin conditions, inflammatory skin conditions, multiple sclerosis. And I've personally seen a number of these patients have very significant improvements to their condition without the risks of steroids or other immunomodulatory medications that can have long-term serious effects, including cancers, because they depress the immune system. So how does LDN work? So naltrexone was given a dose of 50 milligrams to 200 milligrams, as I mentioned earlier. The doses that are classically used when we call it low-dose naltrexone are somewhere between 0.5, so half a milligram, up to 4, 5, 6, maybe 7 milligrams a day. The effects of this is that the opioid receptors in the body, which are all over the body, are blocked, but not for 24 hours as would be blocked by taking full-dose naltrexone, but blocked for, say, 3 hours. And this gives the body the impression that it needs to produce more endogenous morphine, endogenous opioids. So things that you've probably heard the word endorphins, enkephalins. These are substances that are produced by the body when we go for a run, and it gives you a runner's high, and also makes you feel physically better. So this is a way of causing the body to be tricked into producing these substances, and those substances act on various cells in the body, including glial cells in the brain and many other cells, including what are called T regulatory cells, which are white cells in the immune system, which regulate the immune system. They balance the immune system. So through all of these effects, you can have effects such as reduced pain, you can have effects such as reduced inflammation, and low-dose naltrexone has been used even in cancer as a result of this, because it can affect the division of cancer cells. I'm going to go into more detail about LDN in future videos, and I'm going to go into specific studies regarding specific conditions. The important thing that I wanted to get across today was the fact that this is a drug that's otherwise known as an orphan drug, a poor little lonely drug that has been kind of forgotten and left alone. And it's actually very cheap because it doesn't have a patent. It passed its patent over 30 years ago. It has minimal side effects. If anything, it has some kind of good side effects. It often causes people to have vivid dreams that they enjoy and go on all night. Sometimes it improves people's sleep, and doesn't have really many interactions. The purpose also of this video was to bring across the idea that there are drugs, medications that have been developed many years ago that are sort of sitting on shelves, if you like, and that we're not really prescribing en masse because there's no proper research being done into them. And the reason that the proper research isn't being done is because they don't have a patent. And as they don't have a patent, then there isn't a financial or economical benefit to anyone to do these studies. So the kind of institutions that we would hope will do these studies would be government health bodies, perhaps some charity bodies, and even perhaps I'm going to go out on a limb here and say we could have some kind of crowdfunding to to support such research. It wouldn't be that difficult nowadays. So I'm going to go into more detail about this in future videos. Thank you for watching. I hope it's been an informational video, something of interest to you. If any of you have had experiences with low-dose naltrexone, I'd be grateful if you'd write to us on the channel, and we can see if we can even arrange a video together to discuss this further for everybody who is subscribed to the channel and new people. And for now, thank you for watching, and see you soon.